WHO has been assessing this outbreak around the clock, and we're deeply concerned. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
Today, the World Health Organization officially announced that this is a global pandemic. This is the most aggressive and comprehensive effort to confront a foreign virus in modern history.
The coronavirus pandemic has now claimed 5 million lives. COVID-19 remains the leading cause of death around the world.
The coronavirus is impacting communities across the globe, disturbing rise in hate-filled attacks. This has now led some to worry about how to defend themselves, and gun sales are actually up in certain neighborhoods.
We know lockdowns and quarantines are essential to suppressing COVID-19, but they can trap women with abusive partners. We have seen a horrifying global surge in domestic violence.
We're throwing everything we can at this virus, tracking it from every angle.
Coronavirus needs little in the way of introduction. In the 2 years since the first reports of infection in Wuhan, China, the world has seen more than 5 million lives be claimed by the virus, with many more being affected by the symptoms that the virus causes.
During this pandemic, we've seen an increase in reports of cultural and domestic violence, as well as had glaring oversights in our institutions caused structural violence in our society.
According to the Institute for Economics and Peace, the average global peace index fell 0.34% in 2020. In addition to the major loss of life as a direct result of COVID-19, there was also a major economic impact felt by the world over that directly affected the lives of many.
On the micro level, individuals were forced into uncomfortable situations, either due to the toll on the body that the virus caused, or due to the mitigation efforts necessary to prevent infection.
On a meso level, communities experienced massive hardships as they endured a loss of business, opportunity, and overall human interaction. On a macro level, the world was essentially forced into isolation to prevent the disease from taking over. Through this tough time, many were looking for a light at the end of the tunnel.
That FDA advisory panel voting in total to recommend emergency use authorization for Pfizer's vaccine.
At the end of last year, the Food and Drug Administration authorized the emergency public use of the Moderna and Pfizer vaccines. This began the national vaccine rollout in America, with an initial reported efficacy rate of 95 to 98%. Many were eager to receive inoculation. Only 4 months after the vaccine was made available, 50% of Americans were reported to have received at least one shot. The coronavirus vaccine was never touted as the absolute end to the pandemic, but medical personnel encouraged citizens to receive the vaccine as a protection against the virus.
Ready?
This summer, I worked at the American Medical Center and I was placed on the vaccine administration team. Our job was to plan out vaccination events, and that included reaching out into the community to gauge interest and get vaccines to those who wanted them in a safe and efficient manner. I was a project coordinator with Brandon Kinsella and Erica Tamada, and alongside our skilled nurses and registration clerks, our small team was able to vaccinate as many as 3,000 people in 1 month.
So the type of work that we do at American Medical Center is we coordinate vaccination and testing outreaches for the community. So we try and reach out to members of the community to make these vaccination clinics happen.
We tend to go out into the communities to not only make the COVID vaccines and COVID testing more available to the communities, but healthcare in general.
Have you observed any changes in the community since you started vaccinating?
Yeah, so since we started vaccinating the community, it's been really great to see people, their fears have kind of been alleviated because we have this vaccine in place. People are more comfortable visiting their families, they're more comfortable going to social gatherings, and then also going to school and work.
Another great change that we've observed is that we've reopened our island to tourism, which has been a great upturn to our economy. And the tourists are feeling more and more comfortable to travel to Guam and see the beauty of our island. And that's because of our efforts to, gain herd immunity on Guam and, normalize regular testing.
Like the rest of the nation, Guam began to ease restrictions as the vaccination rate continued to climb. Our mission was to contribute to that by making the vaccine as accessible to as many people as possible. We worked with civil society organizations like the Micronesian Resource Center and the Guam Hotel and Restaurant Association to make the vaccination process efficient and convenient.
We are seeing an increase in interest for individuals who are ages 5 through 11, which is also great, but we're hoping to see more of the children population to be fully vaccinated in the next coming weeks.
And I know you guys just had a vaccination clinic for children. So can you just like say how that went?
That went great. We vaccinated upwards or more than 300 of our island's youth. And we're looking at 300 to 400 to return for their second dose, which is amazing.
By performing their professional duty and acting based on their corporate social responsibility, American Medical Center has been contributing to peace building during this pandemic. Despite the changing landscape of COVID-19 and the conditions we operate in, AMC continues to strive to provide important and meaningful care to the residents of Guam.
Yes, we do want to encourage people to get vaccinated, but coercing somebody that's not wanting to get the vaccine, I don't think that's the proper method. Explaining objectively to them how this could protect them, how this could protect their families and their community, that's the best route. You don't want to force anybody to get something that they're not comfortable getting.
You should get vaccinated because it's not only for your protection, but for the protection of others. It will lessen your likelihood of spreading it to somebody who might potentially be unvaccinated, you know, the elderly who may not be able to get vaccinated at all, or the youth who are too young to receive the vaccine, or anybody who just, you know, continues to have their doubts and, you know, it is in need of further encouragement and further educating. It's not just for you, it's for them as well. So we would encourage everybody to get vaccinated for this purpose.